think we might as well just go ahead and get started.
Yep.
Good morning, everyone, and welcome to Westside Unitarian Universalist Church virtual service. My name is Linda Phippen. I'm a member of the worship committee whose members assist with services. Many of our services are, of course, led by our minister, the Reverend Carol Bordeaux. Some are led by a member of the congregation, and some, as does today's service, feature a guest speaker. We're pleased to welcome all of you to Zoom service this morning. Please note this service is being streamed live, so if you're having a bad hair day or just don't want to appear on YouTube, you can turn off your video feed if you like. Immediately after the service, we will transition directly into coffee hour, but this will not be live streamed. We hope you will join us then for conversation and catching up. Before we start our service, there are some announcements. Food donations are being collected in the big basket on the front porch of the church. If you do have food to donate, it's best to drop it off between Sunday and Wednesday because Alice Thornton takes food to the drop-off center on Thursdays. We also have a number of special holiday services upcoming, and Reverend Carol's going to discuss those during the coffee hour after the service, so you can some of these services will be interactive and a different experience for us now that we are virtual. Does anybody else have any announcements that they would like to make? Okay, we'll go directly to the chalice lighting. Carol's going to light the chalice for us this morning. And the following reading for the chalice lighting is called Community Chalice Lighting, and it comes from Atticus Palmer. We call this light before us in hope that we may always remain a strong community, working together to make the world a better place. When we are grieving or sad, when we are challenged, when we need help, this flame guides us out of the darkness. When we are cheerful, when we celebrate, when we accomplish a great task, when we return to a place that makes us happy, the chalice reminds us to share our happiness with others. Carol, are you going to we'll do the singing bowl now?
Yes. So good morning, everyone. It's great to see you. Before I have the privilege of hearing Jessica speak, I'd like us to just take a moment to take a deep breath, come fully present into this virtual room, into this community. And as I invite the bowl to sound, I invite you to just find your center. So as many of you know, Westside is a welcoming congregation, which means that we actively support a large group of our community, particularly LGBTQ people. And as part of that, one of the things we do is we have a team of people called our Welcoming Congregation Renewal Team that are actively working at all times to help us stay connected with the community and with active education efforts and active participation in a wide range of community activities. And so as part of that, we are making a point, particularly today, of welcoming Positively Living. And Barry Schumpert, who is on our Welcoming Congregation Renewal Team, is going to introduce Jessica and the organization we're going to be hearing about today. So I'm going to let Barry speak to us.
Good morning. As Carol said, my name is Barry Schumpert. I'm a member of the Westside's Welcoming Congregation Renewal Team, and it's my privilege today to introduce Miss Jessica Langer. She is the Senior Director of Development and Marketing at Positively Living and the Choice Health Network, and this is our Share the Plate partner for this quarter. Positively Living was established in 1996 by a few dedicated Knoxvillians who obtained a $25,000 grant from the Robert Wood Johnson Foundation in order to assist in the care of people living with HIV and AIDS. In 2018, the organization launched the Choice Health Network to enable them to serve more people in more impactful ways. They now serve nearly 5,000 people in East Tennessee who are struggling with HIV, homelessness, mental illness, substance abuse, and disabilities. They have nearly 50 staff members in 4 cities across the state and an annual budget of about $8 million. Jessica herself has nearly a decade of experience in the nonprofit sector, including principal fundraising responsibility for the Girl Scouts of Greater New York, civil rights work in Washington, D.C., and advocacy for the homeless and promotion of affordable housing in Boston. It is my pleasure to introduce Ms. Jessica Langer.
Thank you, Barry, and thank you everybody for having me today. I'm really thrilled to be here. That was a really great intro. Normally, when I talk about Positively Living in Choice Health Network, I kick off with the same info. The organization known as Positively Living has been around for a while in Knoxville. As Barry mentioned, it was started in the 90s to provide supportive services for people living with HIV and AIDS. And as you know, many of us know, I'm sure that was an uphill battle for a really long time. A lot of people around Knoxville and the surrounding areas in East Tennessee still know Positively Living primarily as an AIDS supportive service organization. But in 2018, we've undergone some big changes. In 2018, we launched our Choice Health Network. So the organization is now known as Positively Living in Choice Health Network. I know it's kind of a mouthful, but the Choice Health Network represents the 3 pillars of programmatic offerings that we offer now. So since that time, we have established a full service medical clinic, and that offers primary care, a pharmacy, it's disease testing, treatment, and prevention, because we all know prevention can be one of the most important components for maintaining health, trying to stop a problem before it starts. So our medical clinic we have a supervising physician, we have nurse practitioners, PAs, BSNs, and anybody can, make an appointment for testing and treatments, depending, on what their needs are. Like I mentioned, we can even become a primary care provider. So Positively Living in Choice Health Network, in a short amount of time, has really kind of grown and exploded into a really significant public health organization throughout East Tennessee. As Barry mentioned, now we have offices in Chattanooga, Memphis, Upper Cumberland, in addition to our headquarters in Knoxville. And we even have a presence in Nashville because we just launched a partnership with Nashville Cares in August. And Nashville Cares is the largest HIV services provider in Middle Tennessee. So that is really, the medical clinic is still kind of the heart of what we do, but we've also been building out our other 2 programs. The second is client services, and that is the mental health piece. Because one thing I love about this organization is that they've recognized the importance of mental health care and the recognition that even if you are taking care of yourself physically and maintaining your physical health, if you're missing that mental health piece, your health is incomplete. So our client services program offers mental health care, counseling, and therapy, and also emergency services. Since many of our clients are struggling with certain issues, like Barry mentioned, we treat anybody who's struggling with HIV and AIDS, homelessness, addiction, and also LGBTQ discrimination and disabilities. We have a large umbrella. So for that reason, we have really, really grown in size because of the breadth of people, we are willing to see and treat and help and reach. So the emergency services included in that program can include, emergency food aid, transportation, emergency housing services. So if somebody is on the verge of eviction, we can do a mini grant to keep them in their house and prevent homelessness before it starts, or even help somebody get into affordable housing with maybe another mini grant. We see a lot of people who, maybe they're $400 short for something, and it's the difference between being in a home and being on the street for another month. And it's an insurmountable amount of money for them, but for us, we can kind of be there to bridge that gap. So that program is very dynamic in, the ways that has the flexibility to kind of jump up and help people depending on their needs. And then the third program is our harm reduction program. That's our newest program. And harm reduction, if you're not familiar with it, is a social justice philosophy that kind of recognizes that drug use can be part of our world, and they take a different approach to it than some of the more traditional organizations where maybe, if you want to participate in a program, you have to be clean and sober, you can't do this, you've got to be in by the curfew. We're not knocking any other organization. It's just the harm reduction philosophy works for us because it is really focused on ending stigma, breaking down barriers, meeting people where they're at, and building relationships with people who usually have suffered a lot of trauma. So that program, we do a syringe service exchange, which in East Tennessee can be a little controversial. It's kind of a progressive type of action. It's where people can bring their used needles to us and we'll collect them, which actually the city of Knoxville really loves, because then these used needles aren't ending up on the sidewalk when you're walking your dog or on the playground with your kids. We're disposing of them safely. And then we also give out clean needles, so to prevent the spread of infection, hepatitis C, HIV, the wound issues that can happen when you're using used needles. Of course, we're not encouraging drug use, but it's more like saying, if you're going to do this anyway, and you're not ready to enter the recovery period, at least use a clean needle and then come back to us when you are ready to enter that road to rehabilitation. So hundreds and hundreds of people come to us every week, even especially since COVID has happened. That program has been absolutely jammed, 500 to 700 phone calls a week for help, because we don't only do a needle exchange, we also give out free naloxone and Narcan. I didn't know what that was when I started the job, but it's the substance you can have to reverse a drug overdose. So if somebody is overdosing, it's like a nose spritz, and it can stop the drug overdose and save somebody's life. So we give out thousands of doses of that. We give out free fentanyl test strips so people can test the drugs for fentanyl, which we know on the street, just a couple grains of it can kill you with an overdose. It's very dangerous. So we're kind of doing everything to mitigate damage for these hundreds of people who need that help. And then as they get to know our staff, the program staff, they can come back and say, okay, I'm ready to start rehab. I'm ready to start the road to recovery. And we can get them in full service for the mental and the physical health care that we offer, plus specific types of drug rehab, and we're connected with lots of other organizations throughout East Tennessee that do that. And it's just kind of a supportive network where people don't feel like they can't trust somebody, they can't do it on their own. We will be the organization to hold their hand through the process. It's really kind of shocking work, I think, for people who don't know a lot about it. But addiction really is one of those diseases that can affect your life and touch you no matter what age or gender or race or religion or socioeconomic status you're a part of. And East Tennessee has been classified by the CDC as a vulnerable region for the opioid epidemic, and also for a rise in HIV and hepatitis C outbreaks because of needle drug usage. So that is why having this organization centered here in this kind of hotspot classified by the CDC, it's in the top 26 most vulnerable regions in the nation. I think that's why we've seen so many people kind of pouring through our doors asking for help in this regard. So I know I just talked a lot. I could probably keep talking, but that's an outline of what we do. And I guess one other important thing I would like to mention is, as a result of this growth that I've just discussed since 2018, we last year purchased a new headquarters for our Knoxville location. It was really, we were just bursting at the seams in our old office. We had like 2 offices and it was very kind of fragmented. The harm reduction program I just spoke about actually didn't even have like their own space. We would go to meet people in like church basements or under the bridge and kind of operate wherever we could. So we really needed one central location. And the organization purchased the former, maybe some of you might remember it, the former Lisa Ross Birthing Center on Ayler Avenue. It was abandoned and condemned, but still kind of a really good fit because it had the infrastructure needed for a medical clinic. It already had that infrastructure, 2 stories. And so we've been renovating it for the last year. It's been under construction, and because of the rough shape that was in when we bought it, this year we've launched a 2-year, $2 million capital campaign called the New Home for Health, Equity, and Hope campaign to pay for the purchase and renovations of the building. It's a really, big purchase, the biggest one of our organizational history. It's scary, it's a lot of work, but the organization really felt like we had no choice. If we were going to continue delivering the services to all of the people needing them, we really needed like the space and the capacity to do it. And so we're really excited that this building is going to be a great fit. It's still under construction. We should be ready to move in sometime in the new year. But that is probably the biggest project, other than delivering services and programs that we do, the biggest project, at least especially for me, that I've been working on, and that we will continue to really push forward with in 2021. Of course, COVID has made a lot of barriers and hurdles to how we've operated. Luckily, the staff has all of the PPE they need, so that really hasn't been an issue. They've been spacing out appointments and utilizing telehealth, luckily, because the folks that we work with a lot of them are immunocompromised anyway. We were already doing telehealth before COVID hit, so we were prepared. And we've continued most of our mental health services through telehealth, issuing emergency grants or emergency help. And the harm reduction and the medical clinic are kind of the 2 where we've been able to do some by telehealth, but we've also been able, fortunately, to continue to see a lot of our clients by utilizing PPE and even meeting in outdoor spaces and practicing, safe COVID screening and luckily, knock on wood, it's been a very effective operation despite of all of these, COVID issues.
Well, Jessica, thank you so much for telling us about your organization and the work that they do. I had no idea that it was had such scope, and I'm sure other people in the congregation didn't either.
A lot of people don't. They've never had anybody kind of in a position to do communications or marketing. It's all been kind of, they just do it and keep their heads down. But the community really should know what's happening with this great organization. So I'm still pretty new. They brought me on in February, and I just moved to Knoxville last year, and I had like one normal month before, COVID hit and changed the world. And so we've had our work cut out for us, but it's been going okay.
So I do want to remind the members of the congregation that Positively Living and Choice Health Network is our Share the Plate partner this quarter until the end of December. So yeah, we'll definitely solicit donations to you for that. I think at this point, it looks like since you're finished with your talk, we might just as well transition directly into the coffee hour, so that I'm sure people have questions. I know I have some questions, and I think Barry has some questions too that we'd like to ask you. So if we can just go straight to coffee hour and give everybody a chance to interact together.
Can I just ask permission, since Jessica's going to be answering some questions, would it be okay with folks if I leave the YouTube streaming on while Jessica answers questions, so that her answers also get included in our recorded message? Is that okay with everyone? Okay, great. Okay, great. So I think we can do question and answer just by, if you have a question, just go ahead and we'll do popcorn style. Go ahead and ask your question. Unmute yourself if you're muted and ask your question.
Do you have any interaction with the Interfaith Health Clinic?
Not to my knowledge. That name doesn't sound familiar. We really kind of operate our own health clinic. I don't know if they do a lot of partnerships with other clinics.
Yeah, I don't know either. They provide primary medical care for low-income people, but I don't know to what extent they get involved with drug addiction and HIV patients and such.
Jessica, your services are so extensive. Where do you get your funding?
That's a great question. So historically, a lot of the funding has come through federal and state grants. So for example, the Ryan White program, if anybody is familiar with Ryan White, he was the young boy who kind of became the face of HIV and AIDS decades ago when he contracted HIV through a blood transfusion. And when he passed away, his mom kind of kept fighting for his legacy. And now there's the large, program under the federal government, which offers grants to organizations like us who specifically offer services to people living or trying to prevent contracting HIV and AIDS. Mm-hmm. So a lot of it is grants. We have a 340B pharmacy program since we do so much with preventative drugs. I didn't know this when I started the job again, but apparently now there is a drug called PrEP, which you can take every day to prevent HIV and AIDS. And so we have a whole prevention program to educate people on that and to offer that drug at an affordable price. So it has been kind of government related, but you're exactly right. Now, because of the continuing expansion and needing to pay for the harm reduction program, which there's less government funding for, we have had to work more on our private donations. So for the first time, really trying to cultivate individuals and families in the state, family foundations, perhaps. And we are still continuing our 2 events. They did have 2 events, annual events every year, which was helpful. We have the summer swing in July, which is kind of like a big party. And then we have the People of Courage. I think historically it's been in the spring, but this year we were trying to do it in the fall. And of course, COVID canceled both events. So fundraising, through the events, we're certainly behind this year because we've had to cancel them. We decided not to do them online because we were finding so many people were having Zoom fatigue, and it just didn't seem like it would translate. We actually had a really great speaker lined up for People of Courage this year, Ryan White's mother.
Wow.
And we really would love to utilize her in person. She's such an icon, and she's worked so hard, and we're just hoping things will be better in 2021, where we can continue our events, we can continue to meet with people in the community and build up our individual support network to be where we would like it to be. We are launching in 2021 or over the holidays the Positively Giving Society. That's kind of like a little bit of a major gift effort. It's kind of a group of, we want to give recognition to donors who can make a gift of $1,000 or more annually. And that's, something that we hadn't really done before. That will come with more kind of benefits and recognition. And some people are already choosing to join that with a gift of $84 a month and or a one-time gift. But these are all kind of things now. You're right. We've had to think of new ways to expand in order to continue meeting the needs, financial needs of the programs, and keep up with the financial health of the organization.
Jessica, I have a question about how your clients or your patients become your clients or patients. How do they find out about you, and how do they connect with you for services?
Yeah, it's kind of incredible. You're not even going to believe this, but it's mostly word of mouth. As I mentioned previously, we don't do a lot of advertising or marketing. We've never really put that in the budget. Some things we do have a part of, like, for example, we sponsor Pride every year, Knoxville Pride, and so we'll be involved in that. We sponsor some things for it, like the Gay Man's Chorus. So we do get our name out there a little bit, but the majority of the folks who come to see us, it really is through their own word of mouth and spreading the word that way. I think because so many people that we serve have felt marginalized or neglected or discriminated against in the past, they are looking for a safe space where they can receive the healthcare that they need. And we are known in circles as the organization that can provide that. And it's especially incredible with the harm reduction, because we really don't, we have an Instagram and we have a Facebook page, and that's kind of the extent of external relations we have. And yet we still have, hundreds and hundreds of people calling us every week. So the need is certainly there, and we're not doing that much to solicit. We're just, people show up and we're meeting the needs that way. It's really incredible.
Jessica, do people have to verify that they have HIV to get your services?
Well, not all of the programs you need to be HIV positive. The harm reduction program will treat anybody. For example, you don't have to have HIV. I don't think there's like a rigorous proof process. But I think, like, for the medical clinic, if you come in and get tested a lot of people still don't know that they have HIV. 1 in 7 is the statistic that, who do I have? Just the government kind of puts out that 1.2 million people in America are still living with HIV, and 1 out of 7 don't know that they have it. So we're still doing a ton of testing. And then as far as treatment is concerned, I don't think that they're looking for people to prove it so much. It's more like, somebody shows up and says they have it, and I think that's pretty easy to verify with a blood test these days. You can get an HIV test and get the results back in 20 minutes. And so we do that for people all the time.
Can you talk, Jessica, a little bit about the demographics of your clients? I mean, I think I have a pretty preconceived notion of what a drug user is, but can you tell us a little bit about your clients?
Yeah, absolutely. And I don't know what your preconceived notion is, but I know mine was just like shattered when I started the job, because luckily before COVID hit, I had the opportunity to go to an SSP day with the harm reduction program. And I saw like the hundreds of people that were lining up around the block to come in and receive the services. And it really is folks from all walks of life, male, female, young, old. Some of them appear to be low income or homeless, and some are actually just using to maintain, is what we call it. So it's kind of the equivalent of being a functioning alcoholic. Some people, we have like hundreds of people in this situation. For example, they got in a really bad car accident a few years ago, didn't have the support or resources or money, or maybe it hasn't even been developed for effective long-term pain management. So they've turned to opioids, and then they've gone off that prescription, and then they turn to heroin. And so some of these folks aren't using to feel like that euphoric high that some, people think of. They're just using to be able to get out of bed every day and go to their jobs. So I remember like there was one man who came in and said how many needles he needed. And he said, "This is for my whole office." And I was like, what? I was shocked. So it could be a whole office of people that you have no idea by just looking at them that they might be struggling with substance use. And then in terms of our other programs, I mean, many of the people we serve are low income, many are homeless. And then of course, many are identify as LGBTQ. So populations, again, that maybe have been faced discrimination in other places, and they've finally found the organization, that we're not just treating them with bare bones care, like we're going above and beyond to provide really thoughtful services using a trauma-informed care model, which recognizes that a lot of these folks have suffered some type of trauma in their life, and we need to do kind of high level quality tailored services based on the needs of the individual. So it's very diverse. It's a very diverse client population, I would say.
I have, this is sort of a observation more than a question, maybe. I've been aware of Positively Living since its early days. I wasn't aware of the Health Choice Network until we started talking. But I remember that Positively Living provided almost like daycare services and other services for people with HIV, with AIDS, back at a time when there was a big stigma associated with those people. And I wonder, I'm guessing that has a lot to do with the your organizational state of mind about harm reduction, as accepting people where they are, even though they are stigmatized, and providing support that they can actually use. I'm just thinking that probably grows out of the origins of the organization. Like I say, it's
Yeah.
not really a question, it's sort of an observation.
Right. I agree with that observation, though. I think that breaking stigma, ending discrimination, and treating people fairly and with dignity and respect has been that early value, and that is a thread that certainly continues through to today. Our vision is a future of health, equity, and hope. So I feel like we communicate that vision even more than our mission. It's so important to us. So I think your observation is correct.
How do people get involved? Like, how do people get involved with your organization? Do you have volunteer services or any kind of thing like that?
Yeah, so it's a little tricky right now, especially with COVID, and even without COVID, because of the work that we do sometimes is so specialized. Like, again, with the medical clinic, a lot of them are, trained or certified in some way. With the client services, same thing. We have licensed social workers and therapists on staff. We don't have tons of roles for volunteers, like people who just want to pop in for a day, just because with the clients especially, it's all about building rapport, relationships, consistency, and of course that kind of expertise to be able to work with vulnerable populations. So, and then COVID adds another layer of complexity on that. One thing that I know that we are still doing that we still need volunteers for, harm reduction assembles naloxone kits. So remember I mentioned we give out the kits to help reverse drug overdoses, and they give out thousands of them, hundreds of them. So we still are taking volunteers to help assemble those. That's still been a need. And so most people who kind of inquire about volunteering, that's where we're pointing them for now. It's very specific, but the program really, uses that help. So that's probably our number one volunteer opportunity right now.
And that's an awesome service, by the way. That's amazing that y'all give out those kits.
They make a big impact.
For sure.
I'm wondering do you have any interactions with law enforcement, since, the drug users have, encounters with the legal system?
We don't work with law enforcement. I don't think like there's a bad relationship or anything. It's more just like we operate that program, and we don't, we kind of operate it the way that we think is best. It's not that we don't work together. We do have a relatively new position, and I think this person might know more, and I haven't had a chance to really meet her, talk to her yet because of COVID. But kind of maybe recognizing your question and the natural relationship that kind of exists between, illegal activities and law enforcement, and the need for mass incarceration reform and all of the issues that, that's a whole separate topic. But we did a few months ago create this new position for a woman who had been getting her master's and had been interning with the Department of Corrections, I believe. I hope I'm right there, with the city, if not with the county, maybe. And so her position now, her role is to meet with people who are incarcerated. So some of them, it could be like long time incarceration. Some, I would imagine it could be shorter term, like they were picked up off the street for drugs or something like that. And they're, HIV positive, or they need some type of service relating to that. And we can help them reacclimate kind of into society, say, connect them with services that they need. So it's not just like that cycle that happens so frequently where it's reincarceration because people get out and they're in the exact same position they were in before with no resources or support or any type of, advice or safety net. And we're hoping to break that cycle with that person. And so she's been kind of working full time, and she might even have relationships with law enforcement I don't know about. That is still pretty new. But again, it's kind of that dynamic vision where it's like, oh, we see that need and we can pop up with a position to try and fill the issues. If that makes sense?
You do any work with Family Promise?
It's really possible. I don't know what do they do?
Our church is a supporter of them, and they support homeless, mostly families. And I think there are some pretty strict requirements as far as being part of their program, as far as their clients. And correct me if I'm wrong, Carol, but I think their clients have to not be using drugs and also pledge to make certain movements toward being responsible homeowners, and they have to take classes and things like that. But I was just wondering, you were talking about homeless population and whether you had any interaction with them.
We might help the clients that got kicked out of that program.
Yeah. We have actually seen, when we hosted Family Promise here before, we have seen clients that were in the Family Promise program who were discovered to be using again, and they were removed from the program. So now we know if that happens, we know where to send them.
Yeah, we probably wouldn't work. I can't say for sure, but we probably wouldn't work with a program like that. It just seems like maybe two different philosophies. I really don't know though. There's the partnerships programmatically is a tiny bit removed from me, but also once we get back into the office and we're not working remotely, we can start to have those conversations again. And this, in 6 months, hopefully I'll be able to name everybody that we offer resources to and partner with.
Okay. I was just wondering because, we have some ties to Family Promise, and I thought, well, wouldn't it be neat if these two organizations work together? But
I know they might, and I don't even know. Yeah, I'm sorry. I could find that out and get back to you guys.
So do you have another question? Do you have any non-English speaking clients?
Yes, for sure. We are good friends with Centro Hispano. That's a great organization. And we do have staff who are bilingual and multilingual. So certainly a lot of our participants are English isn't their first language, or they're people of color. So yeah, again, it's a really diverse client group and staff as well. Our staff is stacked. I mean, we have MPH, PhDs, MDs. It's a very impressive staff.
So approximately how large is your staff? How many people?
It's about 50 people.
Yeah.
Yeah, and it probably should be bigger, but again, we have to grow thoughtfully.
Mm-hmm.
The funding is an issue. We've grown so much in the past 2 years, and that growth will probably continue or would continue or needs to continue. Funding is definitely the biggest issue, the biggest barrier to making that happen.
That's an excellent segue for Barry to tell us how to donate.
Yeah.
Gotta unmute there, Barry.
I will attempt to post this on the chat section of the Zoom meeting. But if you want to contribute to Positively Living and Choice Health Network, you can visit the donation page on the WUC website. And that's that's westsideuc.org is the website. and there's a button there for donation. You click that, and then it brings up a screen, and in the tax deductible section, you can enter a dollar amount next to the share the plate window, and that money would go to Positively Living Choice Health Network. If that doesn't work for you, you can simply send a check made out to WUC, send it to the church office, and write share the plate in the memo line, and that would also work. I will attempt to post these to the chat, but we'll see how that goes.
And we'll be taking donations for Share the Plate for Positively Living and Choice Health Network through the end of December. So we actually started that in the summer quarter, but because of COVID, we extended it all the way through the fall quarter as well, because it's been a little bit harder to do Share the Plate with us not being together in the same ways we have in the past. So we've got 2 full quarters that we're doing that. So you can make your donation anytime between now and the end of this month, and that'll all be going. That'll be going to Positively Living and Choice Health Network probably in early January. And thank you. If you've already done that, thank you for doing that. Thank you for doing that.
Thank you. That's amazing. And I know this is a lot of info. I know that it's a big kind of high impact organization. So if anybody has any questions or wants to learn kind of more about a specific program, our website is www.choicehealthnetwork.org. You can Google Choice Health Network and it'll pop up, or Positively Living. Both will take you to just our one central website. And then, of course, if anybody has a Facebook, please like us on Facebook. We do a lot of, we keep up with it. We keep up with the social media, and we share a lot of lots of interesting kind of like progressive content, I would say, if you're into that.
Anybody have any other questions for Jessica?
I actually have one last question. So you had your needle exchange program. What's the status of needle exchange in Tennessee?
It's legal.
Is it?
Yeah.
Good.
I mean, we're certainly not breaking any laws by doing it. I think it's just stigmatized and maybe hard for some people to understand. I think some folks, it seems a little controversial, like maybe you are encouraging people to use drugs, but the main goal of it really is actually to prevent the spread of infection, and also to build relationship with people who are using. So then if and when they're ready to get sober, we're going to be the first people that they call. And they do. We actually are sending out a holiday appeal right now, and it has one woman's story. And it's very, very moving and eye-opening. She was just a nurse, like regular woman, an RN with a family. And that's when I told that example earlier of somebody who had gotten into a car accident and turned to kind of went on this, it snowballed into a substance use problem. It's because of that appeal that I just read, and we have hundreds of people in her shoes. So it's allowed, the state allows it, of course, you know, again, nothing we're doing is illegal. It's all perfectly legal, and I mean, really like found to be best practice. It's just the state doesn't support it. So I would say out of our 3 pillars, that program is the least, you know, funded or supported by Tennessee dollars. I think, yeah.
Okay, I have a question. This has to do with the age range of your clients, and I'm in particular interested in knowing if you have any teenagers or children as clients.
So for the medical, I mean, the medical and the mental health and the harm reduction, I don't think any children are receiving those services, but we certainly do serve like teenagers. I know it's been a thing where, you know, we've had some clients who have come out to their family and they've been kicked out or disowned or become homeless and turned to drug use. we serve a ton of clients who are in that boat, and they're young. And then definitely individuals who have children. So like we do say we serve, families. It's just not that we're like testing little kids. We're not like, we don't have like children in the clinic, but we serve, their parents and families by proxy. Yeah. But I mean, certainly some of our clients are young, especially on the prevention. Our prevention coordinator, he does really important outreach to people. I mean, in, 18, 19, 20, like you're out of the house, you're maybe becoming like sexually active for the first time, and they're saying, hey, like, do you know about PrEP? So definitely like teenagers and up, I would say. And then there's no age limit. Some of our clients certainly are elderly. It's a very, very broad age range.
I have a question about the volunteer service that you mentioned. How do you learn more about that?
Sorry, you cut out for just a second. Which service?
The volunteer service that you mentioned earlier about assembling the bags.
Oh, sure.
How do you learn about that? Like what days or times?
Yeah, anybody can email me. Because of privacy reasons, we don't put that much contact info on our website. My email is one of the few emails that appears. So I get a lot of these requests anyway, and I kind of filter them or transport them to where they need to go. So I can write my email in the chat box. And if anybody has any questions about anything, including volunteering with the naloxone kits, you can just email me. That would be the best way. And I can introduce you to the director of that program.
Thank you.
What kind of an education did you get to prepare you for this? Because it's you have to really be dedicated in these kind of issues. Otherwise, it would just take you down emotionally.
Me personally, or the staff in our organization?
Well, yourself, but also inclusive. I mean, what is the normal preparation for a lot of this? Is it in the medical field, or is it in the social services field, or is it a combination of both? Is it just that, there are some people that have the empathy and want to do good works.
Yeah.
What are your candidates? What kind of candidate do you look for?
Again, it's really diverse because so many of the people on our staff do have kind of that professionally trained background. Like our director of harm reduction, she has her master's in public health. Our director of research, she has her master's in public health and her PhD. In the medical clinic, again, people have like medical training backgrounds and degrees, but we also have positions like peer navigator, where it's like a concierge service kind of for our clients who are coming in. Maybe they just got a positive diagnosis. Maybe they're in crisis for another reason, and they just really need a supportive person kind of shepherding them through the process. In some of these cases, the staff we look for are people who have been in these situations before. We advertise positions and we hire saying, are you HIV positive? Have you ever been homeless? Have you ever been kicked out by your parents by coming, out as gay? And we have people, empathy is so important. And if somebody has been in those shoes before, that's usually somebody we want on our team. So it's a very diverse staff. Me personally, I think everybody probably has a harder job than I do, although everybody says, I would never want to do your job because fundraising sounds so tough. But I mean, when you're direct service and you have to work with clients day in and day out who, are having a really rough time, you have to be good at compartmentalizing. And I don't know if I could do that. So I don't. And I'm just kind of on like the back end behind the scenes. And it's a little bit more exciting. So everybody kind of fits in and finds their place within the organization. and it seems to work really well that way. I have my bachelor's in political science and philosophy because I thought I wanted to be a lawyer. And then when I moved to DC and I started working for a civil rights legal nonprofit, I realized I could make a difference in the world in other ways that didn't involve putting myself like tens of thousands more dollars into debt. So I just fully transitioned to the nonprofit sector, and I've been in the nonprofit sector ever since. There's a lot of issues I care about. So I don't think it's not a temporary thing for me. It's probably where I'll spend my whole career. And I'm in the process of finishing my master's in public administration here at the University of Tennessee. I started that when we moved here. And if all goes according to plan, I should graduate in May. And so an MPA, that's, just more deeper expertise in serving the public, working with state and local government and being aware of the bureaucracy. And so kind of on my end, that seems like the most helpful advanced degree to obtain.
Thank you.
Jessica, thank you so much for taking the time to spend an hour with us and answer all our questions. And also thank you for all the good work you're doing and the organization's doing.
Yeah.
I had no idea. You were doing that much there. So thank you so much. And everybody, if you have more questions for Jessica, Jessica has put her email in the chat, and you can also get it through me or Barry or Linda. We've got each other's email addresses. I'm going to turn off the live stream